We are here and we are strong. Let's be counted as we move on. Make a difference, change lives as we tell our different stories. We are capable, beautiful. We are born to do great things. We're unstoppable, incredible, 'cause we're differently abled, differently.
Hello everyone, welcome to yet another episode where we shed light on important issues in the disability arena. My name is Jane Theory. Let's get started.
'Cause we're differently abled, differently.
Lupus is a chronic autoimmune disease that affects millions worldwide. With no cure yet, many patients depend on medication for its management. Take a look.
World Lupus Day is observed every year on May 10th with an intention of raising awareness about lupus, a chronic autoimmune disease that affects millions worldwide. This day aims to increase public understanding and promote research into its causes and cure. The Aga Khan University Hospital, in partnership with Lupus Foundation Africa, held an event in honor of this day.
Lupus is such a difficult disease to live with. It's just for us to raise awareness that this is actually there and to see if we can help our lupus get more traction in terms of mileage, people know that lupus actually exists.
It's our day to come out and shine out of it and create more awareness. In fact, while we are here, we are looking for a way to create awareness and let the world know what lupus is, what we go through, how we survive out there, and how to manage lupus. Yeah.
Lupus is a chronic condition that results from a malfunctioning immune system. There are different types of lupus, the most common being systemic lupus erythematosus.
Lupus is an autoimmune disease. So what does autoimmune mean? That the body's immune system is designed to fight infections. When you have lupus, the body's immune system is faulty such that it's unable to identify what is a normal cell and what's a germ, so it fights everything. So it sure can affect any part of the body. Usually it's more common in ladies. We don't know why, but suspect estrogen may play a role, and usually affects ladies in the childbearing age between the age of 15 to 45. As to what causes it, still theories out there, nobody can say for sure, but we feel that there could be a genetic component to it, and on top of the genetic component, multiple factors come together and get the disease. So how does it present? Commonly, like the data we've done in Kenya, usually they have pain, joint pain, they have fatigue, fever. They also have skin issues. Usually they get like a rash here on the cheek, and they're also sensitive to the sun. Yes.
According to Dr. Sheila Achieng, research is vital as it aids in establishing valuable information that is beneficial.
Again, research is important to empower us through education, because when we do studies, we publish the results. So we have access to up-to-date information, and we can provide educational programs and online resources for individuals living with lupus to understand how these treatments work. And then there's the issue of global collaboration and advocacy. So we use our expertise and resources to advance research globally and raise awareness so that we have equitable access for all patients in whichever continent you're in, you can access these treatments. Why do we need African patients participating in lupus research? Lupus affects African populations much more severely than it affects Caucasian and other populations. And we need to understand why this is the case. So if we include our African patients in research studies, the results will be representative of the African continent. Genetics play a huge role in developing lupus. Dr. Genda spoke about how you might have a relative who has lupus, and in some clusters of certain ethnicities, you find lots of different autoimmune diseases. So we need to understand how the genetic profile in Africans affects your risk of developing lupus and what role it plays in developing this disease. And certain treatments are better in terms of reducing that risk of infection. So if we don't know what the profile is in Africa, then we cannot advocate for certain treatments within the continent. So we need to carry out this research in our African population to be able to understand these issues.
Symptoms can vary greatly from one person to another and are often similar to those of other conditions. It may take months or years to get a definitive diagnosis of lupus.
So as a doctor, what I'd like people to know, number one, is that lupus exists. It is a rare autoimmune condition, but it does exist. We have so many patients suffering with this condition. Some of them do not know that they have it. Others know that they have it, but they do not know where to go. So for one, when it comes to what we would like patients to know or people to know about lupus, is some of the signs and symptoms to look out for. And once they've experienced certain symptoms, they need to seek medical help. When they go to their doctor, we also need to make our clinicians, right from the level of the nurses to the clinical officers to the doctors, we need to make them aware about lupus, to know the typical manifestations of these conditions, and then to know what tests to order for and what line of treatment to follow.
There is no cure for lupus at the moment. However, the condition can respond well to a number of drugs. The earlier the treatment is started, the better.
It's difficult to say. Why? Because partly we don't know what causes. For example, like malaria, typhoid, we know it's parasite 1, 2. So treatment is a bit easier. But for lupus, there's no really cure per se because we still don't know what causes it. So our treatment plan as it is the example I use is fire. So the immune response has to have a fire, it burns the body. So the treatment we give is to quiet down the fire to a level that the body can control. If we're able to control the fire for a long duration of time, call it remission, we can safely withdraw the medicine slowly and how the patient responds.
While drugs are important in controlling lupus, there's also a lot one can do to help manage the symptoms. Having a healthy diet and exercising regularly, for instance, can help reduce the risk of developing more serious complications of lupus.
I was one person who was dealing with a lot of fatigue, and I don't deal with fatigue anymore. How? That's the question. Yeah, exercise. And let me tell you, the moment I started taking steroids, of course, we all know when we take steroids, we eat, and especially junk food. And that's why I said you have to accept you have lupus. Because the biggest flare up I got is when I did not accept I have lupus. But the moment I accepted I have lupus and I did a research, I also did a research on lupus. For my case, I'm dealing with lupus nephritis. There are some of you who are dealing with just SLE and others discoid lupus. So I changed my diet. I accepted, and that's why I've been on remission for a long time. Because I changed my diet and I exercise. If I can show you my pictures, when I started taking steroids and when I was diagnosed with lupus, I added weight to 94, and right now I'm 56 kgs. And the biggest stigmatization we face as lupus patients is being judged, being called lazy, and if you are taking steroids, you are, women hatupendi kuambiwa tumezeeka. I used to look like an old mama, let me tell you. And then I had this belly, the stigmatization was so bad, by the way. And then steroids lighten us. So I was white. I'm light, but I became white. So even my family members were saying I'm bleaching. And that, I love my mom. She really fought for me, by the way. And let me tell you, when you change your diet, when you exercise, you're asking how you start exercise. Start walking like a 10-minute walk. Tomorrow, 20. Let me tell you, right now, I can run at 2 kilometers. Run.
My parting shot would be, 1, we are not owning this disease. Yes, it's there, we're dealing with it, but you're not going to own it. The moment you own, and when I say own, I don't mean you don't accept it. You accept it, but you deal with it, but do not put it now to be your baby. Ini ugonjwa yangu. I don't think it's good even for your mental health, because it's like you're telling yourself you're cut for it. Are you all cut for lupus? You're not. You're cut or greater things. There's so much out there that can be done. So don't tie yourself down to a butterfly. Don't. In fact, be that butterfly that wants to go, if you get what I say, to go out there and do the things that cannot be done. Okay? Number 2, mental health is very important. How we assist any other warrior to deal with their mental health. How can you be of help to other warriors? 1, talk about lupus and educate the ones who do not know anything about lupus. Do you know how smart you will feel if you dress down someone who knows nothing about lupus? Very few, and I'm talking like this because even some doctors, and I repeat, do not know or understand SLE. Yeah. So if you can, that's why we're being called doctors. Even me, I've been called a doctor many times. Because there are people I've walked with this journey. And how do I get people to walk with this journey? Is because I talk about lupus a lot. Actually, I shout about it. I don't feel embarrassed. I don't feel whatnot. I'm not saying that I'm proud to have lupus, but what I'm saying is I am proud every single day. I have 2 or 3 or 4 people who call me to tell me, Flora, there's this young girl who's been diagnosed, or young boy who's been diagnosed with lupus. Can you find time to talk with them or visit them in hospital? Why do I get those calls? Because people know that I have the disease and I manage it. Don't be afraid that someone will know you have lupus, because someone out there needs you to help them or talk to them because you understand the disease. So therefore, keep shouting about lupus. That is the only way that people will understand how this disease operates.
Your story. Once you start telling your story, your power, it gives you power on who you are. Let's make each and every person a safe space in a way that you can foster empathy, compassion, and let's empower ourselves on what lupus is. Don't be a good Samaritan with no skills. It can be assisting someone, but you don't have the skills. For example, somebody is performing a first aid, but they're choking the patient, or they're choking the victim. So don't be a good Samaritan with no skills. Empower yourselves, have empathy, and above all, tell your story. Thank you.
Even with the scarcity of rheumatologists in Kenya, there is still hope for better things to come.
Yes, so it's very true. There's really a huge gap in terms of the number of rheumatologists in our country. Right now, we are only 13 of us, 11 adult rheumatologists and 2 pediatric rheumatologists, serving a population of about 50 million Kenyans. So that is really not adequate. So what we would recommend is that training be offered both locally and even support to do some of these trainings. Most of us have to travel abroad to do rheumatology training and then come back and practice. So we would like to just compel the stakeholders, compel the training institutions, compel the government and other bodies that are involved in making decisions that will help increase the number of rheumatologists in our country.
The gaps in Africa are large because, take for example, like Kenya, we have 2 pediatric rheumatologists, and that's the most in East and Central Africa. 11 for Kenya is a lot. Uganda have 2. Tanzania, I think, have 1 or 2. So you can see the gap is everywhere. So in terms of how to address the gap is that, 1, if the government can help in terms of funding for training of some of these doctors. 2, we have some programs set up as an association where we're going towards the mashinani. It's called Uwezo Rheumatology. So we come together. A few of us go to the mashinani, we empower the doctors and the clinicians on how to pick up the disease early, to give them some small information. If they are stuck, they can refer, they can manage, they do what? They refer. But more importantly, the medical schools is something which we need to take advantage of now. Because we're trying to see if we can come up with a common curriculum for all the universities now in Kenya, such that now, if you're graduating as a doctor, you have a bare minimum of some knowledge for that. As for the patient, it will take some time in terms of getting that gap, but we'll get there. So it's a lot of promise.
Let's take a short break, but we'll be right back with more. Don't go too far.
'Cause we're differently abled, different. differently.